And here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. Seems like there is a surgery for everything these days.
Absolutely. Always coming out with new techniques. That is the way the medical world works. We kind of go to what is needed. But as you see on the segment, everyone has to be aware of the side effects and the risks of surgery and ask yourself if this is what I need. And it's typically not paid for by insurance companies, so you have to have some sort of cash flow to pay for that. It's typically not life-threatening, but it can boost your morale and make you feel better, and sometimes that's worth $6,000.
Maybe you just wave like this as opposed to stretching that arm out.
Yeah, you can never know how you wave, so you want it to be right all the time, especially when you have a sleeveless dress on it. It's important for some people, so I can certainly understand the desire to spend $6,000 on a procedure like that.
All right, on to some of our viewers' medical questions. Yes, this viewer says that she had a baby about 4 months ago and he was pretty big. Her tummy area is still bloated. Is it just swollen, or is her abdominal muscles, are they just stretched?
The abdominal muscles may stretch some, but they can contract, and so that should be better. I don't think the swelling is just related to flabby muscles that are not contracting like they should. There's a lot of weight gain with having a pregnancy, so a lot of times it can take the abdominal wall, the fat in the abdominal wall, to go down. We're all different genetic-wise. Certainly if there's any pain or discomfort or nausea and vomiting, get back with your obstetrician, but probably just takes a little bit more time for that swelling to go down.
So 4 months, she's just trying to rush it?
Well, not necessarily. Everyone is a little different. Some people can lose that weight like that. And
some people can walk out of the hospital in the jeans that they wore before they got pregnant.
Yeah, and they're working out already. Absolutely. Some people are like that, but for her, it's probably taking a little bit longer, so I don't think it's anything to worry about. Another
viewer writes, I heard there's a link between Lipitor and diabetes. Any truth to this?
There is some conversation about that, but it's preliminary. We research all these medicines. We rely very heavily on medications. So there's always going to be information about things about the medications, bad or good. There's always a risk. As you know, we talk about that all the time. But for right now, keep taking Lipitor, keep taking diabetes medications.
Okay. This person wants to know, the only question that they've been wondering, why is it so hard to find a doctor that takes Medicaid?
A lot of times this has to do with reimbursement and just working with insurance companies, getting things approved. Some insurances are better than others. Medicare, Medicaid can sometimes be difficult, and some physicians just select not to work with Medicaid.
Okay. This person says, I'm continually tired. I was told in January that I am in premenopause. Does this cause tiredness?
It certainly can. It's a very common cause of fatigue in females. We certainly can offer them hormone replacement therapy at a risk, obviously, but certainly look for other things, thyroid disease, anemia, medication side effect, but certainly can cause fatigue, and would talk about maybe replacing her with some hormone replacement therapy after discussing the risks.
All right, and we've got lots of other questions. We'll get to those in a minute, so don't go away. Dr. Levine will answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your medical questions. This person says they had a full knee replacement 6 months ago. Now when she walks, there's a clicking sound. What could that mean?
It could just be usual after a knee replacement. It is man-made. Sometimes you get some sounds and some pain, but certainly anytime after any type of surgery like that, just get back with your orthopedist. A lot of times they like to do x-rays, check the alignment, make sure nothing else is going on, but probably to be expected with a knee replacement.
Okay. How can you get rid of stubborn belly fat?
A lot of times you just have to put down the calories, have to put down the bread, the rice, the pasta. You got to get out there and exercise. They say you need 20 minutes, 4 days a week of moderate intensity exercise, and 5 servings of fruits and vegetables a day. You just got to get to the basics. Certainly plastic surgery is always there. Liposuction is still a very popular procedure. I'm not a plastic surgeon, but I know that happens a lot because we're still struggling out there with our lifestyle.
A woman with lupus and fibromyalgia, she has severe pain. How can she tell if it's a symptom of something that is wrong, and what can be done?
A lot of times even physicians can't tell. We need to do a physical examination, to talk to the patient, check their vital signs, looking for red flags such as high fever, high heart rate, maybe a rash. We also need blood work, may see if the kidney function's okay, the liver enzymes are right. So basically we need a medical evaluation to figure that out, and just talk to the patient. If it's been there for a year and it hasn't changed, and obviously it's probably nothing we need to worry about.
This person has severe pain in their right fingers all the way up to the neck. What could it be?
Probably it would be cervical radiculopathy is what we call that, basically a pinched nerve of the neck from DJD of the neck. We talk about that a lot. The nerves get irritating and cause symptoms down the arm. We normally can treat that conservatively, but as the condition progresses, may need some surgery.
Okay, a woman had gastric bypass a few years ago. Now she's gained 12 pounds. Can she take a diet supplement to get rid of it?
Yeah, fruits, vegetables, water.
I don't think that's exactly what she had in mind.
Yeah, but it does help. I mean, food is medicine. Medicine is food. We don't always look at it that way, but certainly we need to understand that our lifestyle is paramount and we need to do the basic things right to help us out.
Okay. This person says, I work long shifts at my job and it's impossible to get 8 hours of rest a night. Is there anything my doctor can prescribe to me to help me be more alert at work?
There's several things. There's a medication called Provigil. It's basically a stimulant which certainly helps increase attention and help with fatigue. A lot of times we may even use a sleeping medicine to get them some sleep so that they are more alert the next day. And again, just do a proper evaluation, make sure no thyroid, no anemia, medication side effects.
Some people would turn automatically to those monster drinks with the extra caffeine. Would you advise that?
Absolutely not. Too much sugar, too much caffeine. Certainly if you have other medical problems such as high blood pressure, heart disease, high risk calorie drink, I wouldn't recommend it, obviously.
How do you treat shin splints?
Well, just kind of a repetitive micro injury to the soft tissue, to the bones of the legs, rest is really the only thing. Maybe some anti-inflammatory medications might work as well.
This person has a 5-centimeter mass on their lung. It's cancer. Is there treatment for it?
Well, is it cancer? We don't know. We have to do that biopsy because it certainly can be non-cancerous. It could be an infection. It could also be related to inflammatory conditions such as sarcoidosis or lupus. So normally we biopsy all masses. That is the only way to tell if it's cancer.
All right, Dr. Levine, as always, we appreciate you taking the time to stop
My
by.
pleasure.
And you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen, fax us 892-7305, or email us at laf@kfdm.com.